Hello, everyone, and welcome to our sixth annual Durban Mental Health Symposium, which, due to the COVID-19 pandemic, is being hosted online this year. Even though we are not getting to meet in person as usual, we've still managed to secure a stellar lineup of speakers and mental health activists who are here to inform us and enlighten us about how we can think, write, and practice differently in the space of mental health. As always, the symposium is hosted by the KZN Mental Health Advocacy Group and co-hosted by the South African Depression and Anxiety Group KZN office. And this year, one of our co-sponsors is also SISA, which is the Psychological Society of South Africa. In this segment, I am honored to interview Dr. Rochelle Burgess, who is a psychologist based in the UK, but who has spent a considerable amount of time in South Africa and is no stranger to KZN as well. Dr. Burgess is a leading figure in the area of global mental health and community mental health and has some very interesting thoughts and ideas about how we can make our research practices and even our own work more transformative in bringing about real change to society. So I hope you enjoy this interview. Thank you for tuning in. And without further ado, let me introduce Dr. Burgess a bit more extensively. Dr. Burgess is a leading community health psychologist who specializes in community-based approaches to health, and her work studies the social and psychological dynamics of community engagement using qualitative, participatory, and transformative methodologies. She is currently a lecturer in global health and a deputy director at the University College London Centre for Global Non-Communicable Diseases. She is the founder and the director of UCL's Global Network on Mental Health and Child Marriage, and she is a fellow of the Royal Society for Public Health, among other affiliations. She has a very extensive CV and has done a host of interesting work over the years. I highly recommend people Googling her and reading some of her very, very interesting papers. In 2020, with colleagues at York University, she launched a network on participatory approaches in global health, of which she is the co-director. Ultimately, her work is about the intersections of poverty, gender, systems of governance, and civil society, and looking at ways in which we can respond to the political economy of poor health. For the past decade, she has focused largely on mental well being and the experience of common mental health disorders, and she's become a leading voice in the emerging field of social interventions in global mental health, of which she'll speak more about in this interview. She has led a range of projects, including in places like South Africa, Colombia, the UK, Zimbabwe, and Nigeria. KZN, like I said, is very much another home for her, as she lived and worked with HERD at the University of KwaZulu-Natal as a research intern early on in her career, and she then did her PhD fieldwork in KZN a few years later. She does say that she returns to KZN whenever she can, and I'm sure as soon as all our borders open, she will be back again. I hope that you enjoy this interview and that you learn much from it, as I hope to as well, as we get to engage with Dr. Rochelle Burgess. Rochelle, so the first question that I have in mind was just for you to tell us a little bit about the work that you do, and maybe just tell us what's inspired some of your current professional interests.
Okay. Um, so a lot of the work I do is rooted in ideas of community engagement, and that the voices of the people that sort of systems are designed to help are included and taken up in the programs that we develop to help them. So I spend a lot of time thinking about the gaps between really nice policy on paper and the impacts of those ideas in people's everyday lives. I spend a lot of time thinking about how do I use my relative position in the world to give voice to people's voices who are often excluded or overlooked or muted by the different sort of processes and practices of academia. How do we think about the promotion of mental health? And I guess a lot of that comes from a few things. In one part, my training as a community health psychologist and a discipline that is very interested in social justice and social movements and to improve societies so that people can live well. Um, it also comes from my position and background as a person who has been excluded in certain spaces, whether that be as a woman of color or as in the space of my life as a service user researcher. I, I have used mental health services for many years at many different times in my life, and often felt that disconnect between what I was saying and what I wanted to say and how I was heard and how systems heard me. And sort of friends and colleagues and people who have had similar experiences to that. Um, and I guess the third thing, which, if I can remember what that third thing is, um, I, I guess I very much feel that research can be a space for bettering the world, if we use the right methods to do it. And so I've learned a lot actually from um, South African scholars in my ongoingly, but very much so in my developmental years, such as Inge Peterson and Kathy Campbell, um, and many others who sort of looked at psychology in a very different way to what I was originally taught in Canada when I studied in Canada, and sort of highlighted how it's a discipline that can be about more than the sum of its parts. So I guess that's sort of me in ensuring people have access to care and that that care is an appropriate reflection of what people say they need when they tell us what they need.
I mean, that's so fascinating. It sounds like the kind of general theme of inclusion is quite important to some of the work that you've been involved in, and kind of including people who've been historically excluded from different sorts of spaces around mental health. And would you kind of particular challenges around getting people included who've been historically excluded?
Well, I guess there's two things. So one of the things is that research itself is often conducted in spaces and languages that everyday people don't speak. And this is not just about sort of like English language, which is one part of that, but it's also sort of the languages of academia. So we talk about things like statistical significance and um, objectivity and knowledge paradigms and all of these sorts of things. And they have an important place in ensuring that what we do design is effective, but that is not without a cost. And I think for a long time, those costs have been underappreciated in terms of what voices are left out of discussions and debates on what are the solutions that need to happen. And I guess what has really struck me in sort of working in mental health spaces in the last few years is the way we think about community mental health and the different types of community that are excluded from that. So in a way, we're very good about thinking about service users, right? So we can think about a service user identity in a very good and clear way. But what often happens is the other dimensions of a service user's identity, um, to use sort of like social psychological and community psychology terms now, these ideas of personhood are not included. So the fact that you are a service user intersects and overlaps with the fact that you're generational poverty, or, or that you were married before the age of 15 in a child or early marriage, or that you were a victim of sort of violence, whether that be state violence or violence of an types of intersections around a service user identity don't often get picked up in the same way. So we're really good at inclusion in one way, right? We're really good at saying, okay, service users must be in panels and service users must be involved in research, but it's very rarely on terms that are equal in power or that pay attention to the multiplicities of sort of exclusion and oppression that can happen in a service user's life. So I guess another big thing that I talk about a lot is these intersectionalities of a person and how any one person can actually reflect half a dozen different communities of interest. And sometimes those communities of interest are also points of exclusion. And so as we make spaces for service users, I think part of that is also making spaces for the totality of that experience, thinking about what are the stories and the realities that feed into the development of a mental health condition in any way, shape, or form, whatever pathway that happens to.
I suppose a part of foregrounding that intersectionality is also then highlighting these kind of power imbalances that you spoke about. And it
Mm,
in some ways maybe perhaps links to an article that you recently wrote in Nature about COVID-19 and mental
yeah.
health responses in relation to that and the kind of neglect of social realities. And I kind of found that kind of idea quite interesting because it seemed like you were, I think, quite directly and rightfully so critiquing the overly individualized nature of our mental health responses during COVID-19 in particular. Um, do you think that people are paying more attention to social realities in the ways in which you think are helpful and useful for service users, or do you think we still have quite a long way to go in that regard?
Oh, that's a good question. Sometimes I feel really hopeful. Um, I mean, I think 10 years ago, that piece that I wrote in Nature would not have been in Nature. Um, I had a piece published in Lancet Psychiatry a couple, well, actually, sort of around this time last year, that I wrote with Sumit Jain from University of Edinburgh and Inge Peterson from UKZN and Crickland from UCT about sort of social interventions in global mental health. And in that piece, we talk about moving beyond sort of the medical. And I didn't think that was a thing that I would ever see published in the Lancet Psychiatry. So I think that we are definitely living in times that are more open to these ideas in ways that we haven't seen before. But I think there is still further to go. And I sort of will have to use these opportunities to sort of leverage and develop new types of projects and new ways of thinking that focus a lot on transfer of power and ownership away from the traditional spaces that may have held them. And I think that, we're sort of in a time where there's a good opportunity for that. And I've seen some really interesting work coming out recently on sort of looking at cash transfers, for example, and unconditional cash transfers and their impact on mental health in households, and sort of highlighting that actually they have a huge positive impact on mental health in households, which is now evidence to support what a lot of sort of ethnographic and life history work that I've done and many before me have done to say that poverty is bad for people's mental health. And so there's now a coming together of disciplines that used to sort of not really speak to each other. And that is something that's hugely positive. Um, and so the trick will be to sort of think through what that looks like in service design. And so one of the things I'm really adamant about is if you work in a truly sort of participatory or co-production paradigm, then I always sort of say to my students that participation, when it's working, if it's working in a transformative way, should feel at least once like everything's going to fall apart. Because if you feel that way, then that means you are giving up power. and you are giving up control, and you are allowing somebody else to talk about and dictate what this should be. So when you feel that way, then there is a transfer of power happening. That's what that discomfort is. Power is never conceded without demand. Power is never given up without demand. So you should feel those tensions in the participatory, co-production, engagement type of work that is happening, because it means you are giving it to somebody else to make that decision. And I think it's on all of us in global mental health to start thinking about how do we work in different ways that do that in a real meaningful way. Because I think that's one of the most amazing things that I have found over the years, not just in South Africa, but other places. I've worked in Colombia, for example, and sort of around post-conflict mental health or reconstruction type of work, is that people survive things all the time. They are surviving every day by virtue of showing up to participate in a research project. They are surviving to highlight and support people's survival rather than automatically dismissing it or paying attention to other things. Can we do things like community-based research and participatory action research, where communities have the driving stick in sort of what an intervention might look like, and its development, and evaluated and talk about things like scale up. So constantly rethinking what research is for and who research is for. And I suppose for me and many colleagues that I work with, research is a vessel or a pathway through which in their everyday lives, and treating it like that as much as possible. I don't know if I answered that question
Yeah,
or if I just
absolutely. I
sort of
mean,
meandered into a new question.
no, I mean
But
it's
yeah,
so
I feel like I
fascinating.
could.
I think just listening to your thoughts on this, and I love the idea of everything feeling like it's falling apart, and that's when you know that you're really kind of handing over power. And I imagine this is
Mm,
result for kind of mainstream research that almost prides itself on pre-planning and having everything go in kind of predetermined route. Um, do you kind of have any advice
mm,
who are kind of trading this quite carefully and for whom this might be quite new? How do you manage that uncertainty, which is probably something that doesn't come easy to people who want things to turn out in a way that they imagine it would eventually.
yeah. Yeah. I mean, I think, look, it's still not even easy for me. When I have those moments, I still think, oh my God, what's happened? Is this all going to fall apart? So I think it's important to, I guess, normalize that. But one of the things that I have found is most important to that um, are, well, there's two things really. One is around communication, and sort of from as early as possible setting out, everybody can talk about what it is that their desire and hope is from the work. So what is it that what are people bringing to the table in terms of their hopes and dreams for this collaborative piece of research? And from very early on, trying to find the places where you overlap and what those similarities are, because those similarities are the things that get you through the difficult times that might come. Sort of reminding yourself and each other that you're all sort of moving in the same direction together. But you need to have had that opportunity to really talk about that and talk through that. And I suppose then one of the other big things that this requires is time. And of course, then this starts to intersect with the very real world limitations of funding windows from different funders, and how long your grant is, and how much time in the real world is actually available. But you need time for things to fall apart and then come back together again. So I think the way you get around that is being realistic right at the beginning as to what a project is able to achieve, and start to build work with your partners in a way that says, look, we might have this funding for a year or 2 years, but we are in this to work together for the next 10 years. And so if that's the case, what are our short-term goals and what are our long-term goals, and what are we going to do now, and how are we going to work together to achieve it, and what are the things that we sort of keep on the back burner as we move on down the line, and how do we keep as much of everybody's vision or desire for what we'd like to achieve in each time as we go. um, so yeah, I think those are the biggest things for me. I had this real privilege of doing an evaluation of an organization that has been working on co-production for like a decade, possibly a little bit longer. And, the fact that that is how they were able to achieve sort of change that transferred power. A lot of things stopped and started, and it took a long time, but they got there because they could do this over a period of a decade. And I think in a way it also requires that we reevaluate um, our idea of wins, which is the hardest thing, I think, working not just in research but also in a social justice framework where need is very pressing, and we want to make things better now, and it sometimes can seem very large. Another thing that I have said to my students in the past is that if you work within a paradigm of small wins, and our small wins sort of over time accumulate and build towards big change, it's very rare that somebody's able to snap their fingers and poverty is gone overnight. So if it was possible, it would have happened already, I would have imagined. And so how do we all work in parallel ways towards short-term, mid-term, and long-term goals? And sort of having those in mind helps with that disconnect and those feelings about falling apart. It sort of reminds us that this is a marathon rather than a sprint.
Yeah, I mean, I suppose in the kind of like publish or perish culture that most universities locate themselves, it might be quite difficult to kind of convince people that these long-term collaborative partnerships that are a more kind of slow cooking approach to academia actually will yield greater fruit in the end.
Yeah.
As compared to kind of like swooping in and just kind of evaluating something or doing a quick intervention, And so, I mean, I imagine that this kind of thinking still remains marginal in the global north, and probably largely assuming because of the kind of domination of Western individualism, if I put it quite crudely. But I mean, I think you've given us some amazing ideas about how we can kind of think differently and out of the box and perhaps even kind of move past this. Do you think that the COVID-19 context has kind of created opportunities for this that perhaps would not have presented themselves had we not had this pandemic?
Yeah, I find that really interesting. I think my answer to that is sort of yes. Um, it showed me ways in which that we had learned, we had learned but didn't realize we had learned. So, for example, if I think about where my career started in and around HIV and AIDS, and how many years it took for people to sort of acknowledge and name the fact that systemic inequalities were at the heart of why HIV was more prevalent in some places than others. Years, like a decade, maybe more, to sort of start to get those, like the language of syndemics and multi intersecting pandemics, and to get that language sort of picked up in policy and practice took a really long time. And with COVID, it happened relatively quickly. We talked about mental health, in terms of talking about mental health and HIV, that took a really long time. It took a month to get that discussion happening around COVID. And then it took another couple weeks to get people to say, hang on, COVID doesn't happen in a vacuum. It's happening in a world that was already unequal, that inequality has bearing on people's well-being. It's not just about disorder, but sort of very normal for us to experience distress as a result of a pandemic that has an unequal distribution of impact across society. And so how do we think about mental health in those dynamics as well, so we don't over medicalize everything to the point that we're forgetting the social reality, but still create pathways and supports for real and meaningful mental health conditions when people do experience them. Those debates happened very quickly. It didn't take a long time for them to happen, which was a real sign of hope for me, that actually things have changed and things do change. And I think because we're already having those conversations about inequality, it makes conversations about power that much easier to have. And those are the types of conversations that need to be had in order to get towards that change that we're seeing. And I think that, just to touch on something else you said about the publish or perish mentality, I sort of feel that, at least in the global health space, that feels a little bit like it's changing. I think people don't necessarily want a publication just for a publication's sake. More and more, the ones that have the biggest impact are the ones that say something meaningful. And it takes time to figure out what the meaningful thing is to say. Now, of course, the time that takes differs by discipline. So it's a bit easier to perhaps do a statistical analysis versus doing a qualitative analysis of 100 interviews of women that have been taken over 3 years. So those timelines themselves are different, but I think the outputs are still both equally meaningful. And it just sort of makes me think a little bit about a comment that Richard Horton sort of published a few months back before COVID about sort of the hazards of just consistently doing sort of like systematic reviews, like the review pipeline, and sort of what are we reviewing for, like, and so I think people are asking the types of questions we need to ask to change that language around publish or perish, which then changes the way academics feel that they can engage in a space, because it is very much about these intersecting pressures. And so hopefully bit by bit, changes happen in different spaces that can leverage and contribute to change in new spaces. And I think we are starting to talk a lot more about academic culture. And as those conversations continue to happen and those things change, the rest of it also, it creates room for other things to change as well.
Thanks, Rochelle. I think I'm also kind of beginning to think about the kind of intersections between global mental health and community mental health, and
Mm.
what your kind of understanding is of where the synergies are and where the kind of differences lie. Because I suppose sometimes when we talk critically about both fields, it almost seems like we speak in the same language, but at other times it seems like we kind of like poles apart. So I'm quite curious to hear your take on the kind of intersection between these kind of two related but slightly different fields.
Yeah, so I guess in a way, um, in global mental health, there is an interest in communities. And so, and that sort of comes from sort of a legacy around deinstitutionalization and move towards community care that is very much a pillar of mental health practice globally, right? And so the language of community comes in that space, and it also occupies a similar language around the role of how you then successfully deliver care in the community. So then there is interest and engagement with community actors and members, and in order to make services more accessible. So very much these interests around community mental health fit with these desires to increase access to care, and also this sort of legacy of care in the community. I suppose where it starts to fall apart a little bit for me, and this might be from my training and knowledge of community mental health from a South African disciplinary backing, is that there is more interest in sort of ideas of justice and sort of like socio-political justice and how that relates to mental health in sort of a community mental health space then tends to be spoken about in a global mental health space. There's definitely an interest in justice and fairness and equality, particularly around sort of this idea of access and sort of reducing the levels of institutional care and reducing abuses that people experience in relation to having a mental health condition, and sort of practices that get a lot of discussion in that space around things like chaining and those types of practices. But as yet, sort of in those mainstream spaces, the movement to justice has been a bit slower in talking about justice around structural violence. Might be a nicer way to summarize that. Where I felt, at least, has always been the narrative in community mental health and community psychology, at least in South African disciplines and European disciplines. So yeah, but I think that gap is definitely starting to reduce. You know, when yeah, it's definitely starting to reduce. That gap is starting to reduce. But when I started the work in global mental health, you know, I guess in 2010-ish, when with my PhD, there was not that kind of discussion around structural violence and the relationship of structural violence to how the field was responding. So it's definitely happening now. So I think over time, that gap will continue to get smaller. Um, and that's something to be hopeful and positive about, I think.
Thanks, Rochelle. You mentioned your time in South Africa a few times, and I know that you were in KwaZulu-Natal specifically. And do you mind just telling us a little bit about some of the work that you did while you were here, and how that specifically has kind of impacted on your thinking and on your professional development?
Oh gosh, yeah. My first piece of research and work that I did in South Africa was actually with the South African Depression and Anxiety Group. And I did an evaluation of the speaking books intervention as part of my master's research. I think it was in 2007 or something. And I got to spend time with um, different communities who had been using the intervention and doing that kind of work, and also with another program, Similando, I believe it was called. If you forgive me, it's a long time ago now. But that intervention, they did something sort of, it was sort of like an oral history type of program, and they did work around memory boxes, and it was around promoting young people's well-being using that intervention. And in those evaluations, when I spoke to facilitators, and we talked a lot about what works, because I'm always about thinking about success first. And then the sort of wrapping up question is, what would be the thing that you would change if you could change anything? And even though both groups didn't really know each other and they were working in different parts of the country, I was doing work with SADAG in Joburg, and Similando was in KZN. They both said the same thing. They both said, well, you know, people talk about poverty and how poverty relates to everything they're feeling, and we don't have anything for that. We don't have anything to support or promote or direct that. And so really this piece around inequalities of an economic or social nature, sort of things around gender also came up then, and what was being missed from facilitators, that has always stuck with me. And then when I did my PhD, it was when I was based at UKZN at Hurd for a while, and then did a PhD in Durban after that placement. And in my PhD, I did some life history work with women who lived in northern KZN by the Mozambique border. And they had participated in a sort of a large epidemiological study that was looking at understanding prevalence of mental health disorders in communities. It's run by Lucy Kluver at Oxford, and she very kindly allowed me to do some qualitative work linked to that study. And we did these life history evaluations with women, and I learned some Zulu, and I was very bad at it, but they were very kind to me. And we talked about their life, and we talked about the survey and their symptoms in the context of their life. So now somebody might call that a cognitive interview, where you start to look at the questions and, whether and how people thought about the questions when they were answering them. And one of the things that came up in that interview again was structural violence and poverty and inequality, and these inequalities and how they very much shaped their symptoms of depression and anxiety or PTSD or any sort of symptomology. They rooted it in their stories of struggle. Um, but they also had amazing ways that they were coping and surviving every day, which sort of led to sort of a couple of my papers that you may be familiar with, and sort of fed into a special issue in transcultural psychiatry, looking at the role of communities in the space of global mental health. In 2012, that came out. And then I guess one of the other big things that's always stuck with me was the piece with, sorry, there's an ambulance going by, was the piece with health systems in that PhD work. And I spent a lot of time with people who sort of made the mental health infrastructure and sort of the primary healthcare model in Kwanagazi, and how they all knew, everybody knew that they were only offering a partial response, that they were doing the best they could in the context of what they had. And the thing they wanted to change all the time was that they didn't have anything to speak to the complex realities of people's lives. If a woman came to them and said, I'm depressed because my children are starving, they didn't really have things to give them. They had to work within sort of the wider structure, and then there were barriers to that. And so that has really propelled sort of the rest of my career in trying to sort of solve that conundrum of how do we fix what we have on offer so it matches what people are asking for. And the ways in which and the solutions that I come to often come back down to how do we engage with and involve communities in the design of what's on offer, and bringing that design and development and evaluation closer and closer into communities themselves, which are as complex as they are in real life, and moving on from there towards action. So everything I do is because of my time in South Africa. I'm still there doing stuff. I've just added other countries. I've never taken away South Africa. It's very much my, I suppose, third home now, because I'm originally Canadian and then I now live in the UK. But South Africa and Durban especially is very much home for me. And I will be back as soon as the borders are open to us to do some more work. So yeah, I
Has
guess
your
that's
isiZulu improved yet, Rochelle?
no, it got worse. It only got worse because I stopped being embedded in where I could hear it. But I still know how to say hello to aunties, so I suppose that's enough.
Yeah, I think sometimes just saying hello is enough to just inspire that first connection, eh?
Yes, yeah. They were all, I mean, they were always shocked, right? And it was in a community where there had been lots of research done. And for me to come in and say, Sabona ma, and they'd be like, oh, what? And then they'd laugh at me and I'd say another sentence, and my few sentences were very much, I'm very bad at Zulu. I'm very sorry, ma. My researcher will do most of the talking and she and I will all talk together, but I'm not very good. So, and that sort of engagement, I mean, they it was much appreciated. But maybe one day my Zulu will get better.
Rochelle, I think a lot of what you're speaking about also links to stuff you've written recently about the kind of political economy of mental health
Mm.
and how it matters and has always mattered. But I think political economy often doesn't enter conversations about mental health. And I think you kind of highlight, I think, almost the tensions, but in some way, the creative tensions and the kind of possibilities that might be able to arise if we use kind of political economic thinking a bit more in terms of how we think about mental health. Do you want to just say a little bit more about this?
Yeah, sure. So I guess I sort of came to the sort of a political economy lens in a space where I was not thinking about mental health originally. I was thinking about violence against women. And Jackie True has written an amazing book about the political economy of violence against women. And the way in which that lens allowed her to really appreciate not just the sort of like the manifestations of sort of structural violence in people's everyday lives, but the fact that this is embedded within sort of big systemic political structures and environments, just sort of like opened a key in my brain that really, got to the heart of this poverty problem, because poverty in the lives of the women that I have worked with over the years in South Africa, and in the communities I've started working with in Colombia recently, and the new work that I'm starting to do around mental health and child marriage. Poverty is a big feature there, but poverty is connected to all these different things. It's connected to gender inequality. It's connected to migration patterns. It's connected to um, uh, sort of geopolitical relationships between countries that mean that some countries are more likely to always be poor and some countries are always more likely to be rich. And I think in a way that becomes really important for allowing us to see the many different levels that work needs to be done at, right? Because if we focus very narrowly, too close to home, just on an individual, just on a patient, or just on their community, or just on their family, we fail to realize what's creating these pressures and maintaining these pressures in the first place. Because, you want to say things like, well, things will be fixed if we just get people access to cash transfers. Well, cash transfer programs are brilliant, but they need to be paid for. And so if we're going to set up a new infrastructure, we have to be thinking in a way that reminds us that there's also pressures on a cash transfer program and where those fundings will come from. So it cannot be and is unable to be the primary solution forever. It is something that we can have in an interim while other work is done in other spaces and to do other kinds of leverage, right? So for me, a political economy lens reminds us that bodies and minds and our mental well-being is always enmeshed in these big, broader structural relationships, so that we don't, I suppose, in essence, burn out as we try to find solutions to very big problems, but our solutions are very small. So it's thinking about, it opens up an opportunity to think about where different levers need to be and who different audiences are that we need to speak to when we do different types of policy engagement and make recommendations around different types of action. So yeah, watch this space for a paper in development with some colleagues around, how important this is and why this is important, because it's something that we haven't thought about a lot, or enough, but touch on in a lot of different ways, but not in an interconnected way. So yeah.
Rochelle, some of your work and some of what you're even saying right now about political economy, it seems to intersect with what might be termed the decolonial turn in psychology.
Mm,
Related conversations about how to decolonize psychological interventions. And it also links to some of the stuff that I've been thinking about and also writing recently around decoloniality and psychology, which has also taken hold quite strongly in South Africa, uh,
mm,
with some strong influence by Latin American scholars as well. I mean,
yeah.
what are some of your thoughts on the kind of decolonial turn in psychology?
I suppose in psychology it's long overdue. Long overdue. Um, but yeah, it's long overdue. I'm just really happy that it's happening. And maybe it's sort of existed in different ways, under slightly different headings. But I think there is a value to naming it as decoloniality and under a decolonization heading, because in a lot of ways, how we understand the mind is very much through a Western lens, and how we promote solutions to challenges of emotional well-being and psychological well-being doesn't give doesn't give as much space as it should to those alternate realities. And I think perhaps a lot of sort of critical and transcultural psychiatry and psychology has been pointing in that direction for a long time. But what decoloniality allows us to do is embed that into a structure of colonialism and racism, and these are really big challenges that, you know, thinking about racism in particular is not really given space in psychology, even though it's not a very good history. So, and other sort of points of exclusion around race or ethnic difference, xenophobia, and for example, would be another one. But yeah, I think the time. I'm glad that it's happening. I mean, it feels like there's a lot happening, right? Sort of like the decolonial turn, and sort of like more and more in discussions about power, but I think only good things will come of it. But there is that definite discomfort, and you feel that discomfort in some spaces and with some people about what this actually would mean in practice as we start to change things and change the world and redistribute power. So, yeah.
Thanks, Rochelle. I mean, we're going to wrap up the conversation because we've just got a few minutes left. And
Yeah.
our theme of the symposium this year is actually looking ahead into the next decade. And what we've asked all our speakers is to imagine that they're in 2030. And if you had to look back on this decade that we're entering, what are some of the kind of hopes and wishes and dreams that you might even have for where, in your case, community mental health might be moving, but perhaps also even global mental health more broadly? And what are some of the more radical changes that you would hope to be actualized in the next 10 years?
Hmm. Well, I suppose in the next 10 years, I would love to see um, strands of funding and research that are focused specifically on scaling up and supporting Indigenous responses to care and treatment, not to change them or build them into hybrid methods, but just to understand why they work and highlight why they work and fund them so they can become more permanent infrastructures in around the world. I think communities have solutions already, and we spend a lot of time trying to change those solutions into a different language. And so I would like in 10 years' time for that not to be the case. Um, I guess I would also like to see I'd like to see global mental health thinking about a few different things, actually. So another strand in my work that often doesn't get spoken about as much is this thing about racism and mental health. And I do that work, and the reason that doesn't get spoken about is because I do it in the UK. And so for some reason, the work I do in the UK does not count as global mental health. Why is that? Well, that is because global mental health is very much like global health, a discipline that actually is about those very old colonial relationships about sort of rich countries versus over poor countries or working with poor countries. Sorry, not over, but in collaboration with. And there's a recent paper that came out in BMJ looking at where global health master's programs are in the world, how much they cost, sort of these huge systems sort of built up and around that kind of disparity. And so I guess in 10 years' time, I'd like to see work that is done around these shared challenges of inequalities and oppression and access in high-income countries to count as global mental health. You know, what do we mean by the globe? That should be problematized more. And also for as a similar way of sort of recognizing expertise in countries where the challenges are, more and more programs that are in those countries, right? So masters in global mental health in South Africa. Well, there's the public health one at UCT, but you know, MSc programs in countries what the world that the discipline is about, that the program is about. And I guess the third thing I'd like to see 10 years from now is the normalization and the embedding of transformative research approaches into everyday practice. And sort of what I mean by transformative research approaches is that research is designed for the purpose of changing something, and that there's always a tangible changed outcome that happens through the conducting of that research. So what is it that people leave behind? There's something that is left behind that is positive out of the research, not just the research project itself. And for that to be the norm rather than the exception.
I mean, that sounds fascinating, and I'm crossing my fingers, hoping that these are actually the things that happen in 2030.
Yeah, it could happen. It's totally possible.
Rochelle, thank you so much for a fascinating conversation. I wish I had a whole nother hour with you because I have so many more questions to pick your brain on. But one of the things I'd like to ask you, and this is maybe a little bit more personal, which is what do you do for your own mental health? Because you know, those of us who are in the mental health space
Yeah,
are at risk of burning out ourselves. And so,
yeah,
kind of, what's on your list of things that keep you fresh, keep you alert, and keep you okay?
yeah. Well, I suppose there's three things. One is therapy. So I make time for therapy in my life. Um, and it is sometimes less frequent than others, but sort of what that does for me is creates a space to talk through some of the things that are quite big and heavy and we can't sort of get through on our own. And I find that to be a necessity for me. And I talk about it a lot to try and normalize it, but you know, I think it's really important. Um, Other than that, I think I have this practice that I sort of do with my partner and my family, my wider families. When things are difficult, I sort of try to get into a practice of asking people what are the sort of asking ourselves what are the top threes for the day or the top one for the day. So what is the one thing today that brought you joy, or what are the three things that you enjoyed today? And at the very least, people can find one. Sometimes you can't find three, but you can always sometimes find one. And trying to create a space to think about things that have gone well or made you happy, because it's very easy to just remember the things that haven't gone well and have been really tough. And it just sort of is a way that also reminds us of our own survival and reminds us of the fact that we are surviving and thriving, hopefully. And then the third thing is, it's a bit personal, but I don't mind saying it. And I've just sort of remembered that like dancing makes me really happy. So it's just sort of this idea around sort of like the physicality and physical health and how important it is to you. But for me, you know, I guess since becoming a mum and moving out of the city, one of the things that fell away was dancing. So, you know, unless you're going to someone's wedding, like, you know, I'm not dancing anymore. And I've tried to actually just put it back in, just sort of like dance around in my living room, which I started doing again when Beyonce's new album came out. And I was like, oh, wow, that feels really good. So now I just dance a lot more, just by myself. And it's fun. Well, sometimes my husband dances with me, but he doesn't have to. Still happens. So yeah, those three are really helpful.
Thanks, Rochelle. I think that's a fantastic list, and I think there's a whole nother conversation there about kind of centering the body more in mental health.
Yeah,
Say, yeah, and how
yeah, yeah.
kind of there is that disembodiment sometimes in the kind of work that we do and in the way in which we think about mental health. Rochelle, thank you once again for taking time out of your day and for
My pleasure.
participating in this amazing conversation. There's so many gems that I'd like to kind of pick on, but I think I'll leave it to our viewers and our listeners to take what they want from this conversation. And I think your kind of hopes and dreams for the future also, I think, leave us with the promise that global mental health and community mental health actually have a huge role to play in kind of improving the societies in which we live, in attending to the issues of structural violence that you spoke about. And I think just paying more attention to the kind of power imbalances and how we can kind of disrupt that in the ways in which we think about mental health, in the ways in which we do mental health, and the ways in which we write about mental health. So, keep doing the amazing, awesome work that you're doing, inspiring many of us from afar. And I hope that our paths get to cross in person when you're back in South Africa, specifically when you're back in Durban.
I definitely will let you know. Don't worry.
Great.
Thank you so much for asking me. It was a pleasure.